What's up, guys, and welcome back to another episode of the Cervantes podcast. Joining me today to discuss his role as an emergency medicine physician, which medical stories have had the biggest impact on him, how he juggles work-life balance, and advice for young people who want to pursue a career in the medical field, is board-certified emergency medicine physician at Northwell Health in New York City and ABC News medical correspondent for Good Morning America and ABC News Live, Dr. Darien Sutton. How are you doing today, Dr. Sutton?
I'm good. That introduction was so smooth. Applause
Thank
around.
you.
Applause around.
Appreciate it. Coming from an anchor, appreciate it. Thank you for being here. I want to take it back all the way to the beginning. Your parents are
Yeah.
both very accomplished in their respective fields. Your dad is a criminal defense attorney, and your mom is an ICU nurse and mental health advocate. Fast forward to today, your twin brother is also a physician. Did you always know you would ultimately pursue a career in either law or medicine based on your family background?
Yeah, absolutely. I think my mother was a large inspiration in my career in medicine, and my father was an inspiration as well because his advice was don't be a lawyer. So So I took his advice and I was led by my mother's inspiration as I watched her get ready for work every day in the pediatric ICU. And I saw that she had a job that she loved where she could help people. And I was always inspired by that. And so from a young age, it was that inspiration plus my love of science that led me to this career.
That's really cool. That's really cool. And then your brother is also a physician. What kind of doctor is he?
So my twin brother is an obstetrician. He specializes in high risk pregnancies, and in medicine, that specialty is called maternal fetal medicine. And so pregnancy in and of itself is a complicated condition, and my twin brother specializes when those pregnancies become even more complicated. And he is now the chief or a chief of labor and delivery at Mount Sinai Hospital here in New York City, doing big things, working on quality improvement and making everyone around him proud.
That's amazing. And then when you had the conversation that you were gonna be a doctor and pursue that career, what was your parents' reaction? Especially your mom that she's already in the healthcare field.
I think my mom always saw it in us, and so I don't think it was a surprise to her. And my parents are extremely determined people, and I don't think there was much of any surprise because they were kind of with us throughout the whole journey. So my mom and dad were there at the science fairs, they were there at the pre-med meetings, they were there at the after-school clubs, the extracurriculars, the research reports, the research rewards, the sports. My parents have been sitting there every step of the way, so I think it was just kind of a gradual experience, just like it kind of was for me. And sometimes they do, I see them, they do look back, or I think they look around and realize how far we've come.
Who are some healthcare professionals you have in the past or currently look up to?
So I look up to my twin brother. I think, of course, he does incredible things and he always inspires me. And then there are physicians that have been really inspirational in my journey to becoming a physician. Louis Goldfrank is one of them. He is very instrumental in the history of emergency medicine. And he taught me a lot about the human side of medicine, which I think is probably the most valuable. It is the most valuable part of medicine. Dr. Uche Blackstock, she is an incredible author and also an emergency physician, and she was one of my first Black attending physicians. As you might know, Black physicians are relatively rare in the United States, comprising approximately less than 5%. Number hasn't changed since the 70s, so it has been an ongoing issue. And she was a shining light in my journey to becoming a physician, and also in my journey out of clinical medicine or veering away of clinical medicine. I'm still practicing as an emergency physician, but she went on to becoming an author and working on correcting the problems with inequity within our healthcare system one step at a time by educating everyone. And she wrote an incredible book called Legacy. And I had a chance to interview her, and that was just an exciting time. And she's always been an inspiration. And then Dr. Shannon O'McNamara, she's also an emergency physician, and she taught me a lot about the beauty of clinical medicine and how it truly is an art.
That's incredible that you had multiple people to look up to because, like you said, it's only 5% in the country of doctors, which is crazy because I did my research and I was like, wow, only five. I figured it would be at least like 10 or just more
Or
than
represent, the numbers that exist in the communities,
that. We gotta change that. We gotta change that.
Yeah,
But that's amazing because
absolutely.
I think if you can see it, you can achieve it. So I
Absolutely.
you had those people. Were these people that were they professors in your medical school, or were these people that you met like as
These were
coworkers
all
later on?
these are all physicians that I met throughout my journey of becoming a physician, and so a lot of them were just one of the first the people who taught me the beauty of medicine. You know, you can learn medicine from a lot of different places, but to really appreciate its beauty, there are only certain people I think that are able to show that or have that talent, and so I look up to them.
So there's neurology, gastroenterology, internal medicine, psychiatry, oncology, and many more different medical specialties. Which specialty did you enjoy learning about most in medical school, and how did you ultimately land on emergency medicine?
Oh, that's a great question because it's not always the same for everyone. I think that when I went through medical school, if you don't already know, throughout medical school, you transfer through a lot of specialties, as you were saying, Cervantes, and you get a little bit of an experience in each specialty. And somehow, in that 4 to 6 week period, you're supposed to figure out exactly how you want to spend the rest of your life, which is completely ridiculous when you think about it. But I think that what part of what part of medicine, I think pathology and pathophysiology, the study of cells and how things work in general in our body is fascinating. And I love using that science to explain the concept of emergency medicine because in the ER, you kind of have to know a little bit about everything and you have to know how each specialty can have its own emergency. And so I think that it really is going to always be difficult for me to put my finger on one part of medicine that I think is the coolest because I think honestly, learning about it and teaching people about it who might not understand it or be intimidated by science is the best part.
That's cool. And it's like, why limit yourself to just one?
Yeah, exactly. That's what
You
every
know?
ER doctor thinks.
And you see, if I'm not mistaken, you see everything and you work on everything. So, do you have I guess it kind of already answered my question, but do you have a favorite? Do you have a favorite right that you work on? A favorite type of
uh,
specialty?
no, I think every day is so different. And I think that's what's beautiful about emergency medicine is that every time you walk in, it's a completely different day and you don't know what that 8 to 12 hours is going to bring you. And it requires you to constantly think, but it also gives you a good barometer reading on what's going on in the community because the emergency room is very much a safety net. And so you get to see a lot of experiences. And I really do believe I learned a lot in medical school, but I learned the most from my patients.
Right, because what you learn from a textbook, maybe much different part is different than real life. That's so
Yeah.
true. My mom is an emergency medicine nurse, so she tells me the craziest stories every day. I'm like, wow, I can't believe that just happened.
I
That's
know it's sometimes,
crazy.
and you get used to it, as you probably know from your mom's experience. You get so used to it. So then when people talk about it, I'm always like, "What do you want me to talk about? I don't remember anything." And then randomly, I'll remember a story, and I'm like, "Oh, I forgot. Yes, this is incredibly interesting."
That's so true. That's so true. Dr. Sutton is a dual graduate of New York University, where he earned his MD at the School of Medicine, and the Stern School of Business, where he earned his Master of Business Administration. How was your experience at New York University, and why was it important for you to also earn your MBA?
My experience at NYU was a good one. I thought it was well rounded and it was a great curriculum in that medical school that helped propel me and help me follow my interests. And then my training at NYU after that, I trained at Bellevue Hospital, which is the United States oldest, one of the oldest municipal public hospital that exists, has incredible history behind it. If you're ever curious,
Wow.
sits right in the middle of our city, and not many people realize the history that it has, but it also has an incredible purpose, treating everyone. And I got to see what it looked like to work within a municipal system. And then NYU, of course, has its private system. And that was one of my first experiences where I realized the discrepancies in our healthcare systems and what the differences look like when you have private versus public coverage. And it inspired me to talk a lot more about that because I think we always assume our health is kind of just a given, when in reality, unfortunately, is very much a privilege. And it really was a great experience to understand how just by crossing the street, you can land in a completely different world.
Right, just off the top of my head, like there's Columbia University, and then a couple blocks away, there's low income housing.
Yeah,
Like so
yeah,
in Ivy League, and I think people forget that sometimes that you're American, we have all this privilege and kind of, but it really depends on your zip code and
yeah.
your cultural background. That's very true.
And to
What
draw it back to your prior question, Dr. Uche Blackstock, in her book Legacy, which I encourage everyone to read, She talks
Okay.
very much about how your zip code is a larger indicator on your health than your genetic makeup. And I think that that statement might not touch you until you really dig into it. It is incredibly powerful.
That's true. That's true. I gotta look at the what was the name of it again?
Legacy by Uche
Legacy.
Blackstock.
I'm gonna look at that. And why was it important for you to also earn your MBA?
You know, for me, it was really a moment where I was trying to figure out how I was going to structure my career. And I found that as beautiful as medicine was, it wasn't a degree that would be interchangeable with the dreams that I had. Had a lot of dreams, was delusional about a lot, and I wanted to take a moment and understand what was going on in the world. And I did not, I had done research, but I was just interested in learning something new. Most people go through a public health, a master's in public health program, but I just so happened to audit or sit in a class in the business school, and I was just kind of blown away by how creative these students were, and it led me to applying. And I was proud. I'm proud to say that I'm a part of the inaugural class of NYU's MD MBA program. Me and
Wow.
five other students started that program, and it was an exciting, rapid, exhilarating time.
So you essentially earned your 2 degrees at the same time.
Yeah, well,
That
I
program,
earned
that
them
program.
within 5 years. Typically, an
Okay.
MBA program is around 2 years, and medical school is 4 years. And so I just cut off a year.
Wow. That's really cool. The dedication that takes to learn two very different practices at the same time, because MBA is already hard. So coupling that with getting a medical degree, that's amazing. We'll definitely touch on that later with time management. You
Yes,
first, you first interned for ABC News in the medical unit back in January 2017. Then you came back to ABC News at the height of the COVID-19 pandemic in March of 2020 as a medical contributor. Now you are a medical correspondent for the network. What was your experience like coming back to ABC during the middle of a global pandemic?
needed. I think that during my work during the pandemic, I got to see very much what the effect of COVID-19 did to communities, to populations. I got to see the disparities that existed. For a moment, we got to see what it looked like when we were able to provide care to all, regardless of your income status, because there were provisions in place that made the system appear as close as possible to what universal healthcare could look like. And there was obviously the rapid creation of a vaccine that required a tremendous amount of education because unfortunately our community, our nation has a fraught history with vaccines and science in general and trust. And it's important also to understand that that trust is that mist or that lack of trust is not out of nowhere. There's a lot of mistakes within medical history. So I thought it was a really great time to provide that education, to recenter people on what's important, and to talk about facts and data. And it really led me naturally into back into television, and that is where I feel the most comfortable.
It was such a wild time, and it's like anti-vaxxers got a lot of backlash, and I understood which because of what you just said, why somebody was an anti-vaxxer, but it's like, come on, guys, like we know, the Tuskegee experiment, people, women in Puerto Rico being tested on, I think, for birth control, if I'm not mistaken. So there's different things that have happened to our community that affect how we see this vaccine, and it was a new vaccine. I try to explain to people like, when we're kids, we get measles vaccines, we get different this and that. So this is similar. I think maybe because it was new or newer that people are like, this has been going on for a long time, so I'll get my kids vaccinated. But for this COVID vaccine, it's like, I don't know. It seems like they just whipped it up. But it's like, do your research, watch the news, read articles, and try to educate yourself, and not just go off of what you're seeing on Twitter or TikTok. So
Exactly.
that's
Exactly. I
that's
think it
important.
just it requires patience, and I think really most importantly it requires understanding that everyone wants the best for children, wants the best for health, wants the best for outcomes, and how can we get there together? I think that's always what is an important reminder in all of this.
Yes. What was it like being on TV? How did you get that experience? Was it difficult transitioning from like sharing medical information online and in person to broadcast?
It's certainly difficult because whenever you're communicating, the platform that you're communicating on often requires a certain cadence, a certain way of communicating, just because each platform has its personality. The way you talk, for example, on a platform like social media is even variable, whether you're on TikTok or whether you're on Instagram or whether you're still using Snapchat. I've never really been successful on that platform, so I just have to throw it in there to seem relevant. versus being on network television, which is a lot more of a formal experience that has a lot more restriction in terms of time and a cadence that is needed to make sure that you are understood by as many people as possible. So I think it definitely requires a little bit of shape shifting, but that is what's so much fun about communication is that it's never the same. Just like
Right.
emergency medicine.
Right. And I like that instead of it's amazing that you kind of got promoted and instead of just coming in every now and then, you have a seat at the table and can have segments and maybe even have a special one day if you haven't already on different medical subjects that people need to learn more about that aren't reported on maybe online or in social media. You can bring that broadcast. And I think it's really cool to see a black doctor on television. I don't remember the last time, especially a black man. I don't know any other black male doctors on TV telling everybody what they need to know. So I think that's amazing too. Was that nerve-wracking at all too, being that you're almost like I don't know, maybe there's someone first, but almost like a pioneer in that space.
I think I am the first Black medical correspondent on any network platform. I have yet
Amazing.
to know any prior ones. You know, I appreciate that. I think about it all the time. I think that there's a lot of weight that I have to hold, and there's a lot of anxiety that goes in with that as well, if I'm being honest. And I'm just trying to make sure that I'm staying true to the principles that I told myself when I first became a physician, which was to make sure that everyone understands what's going on and to make sure that everyone knows their options. And in general, everyone is educated, at least at the minimum, on the basics of what's important. And I think that I hold that to my heart and making sure I continue to treat people how I want to be treated, making sure that I'm understanding of grievances and realize the history and the pain that people also hold with medicine so that I can be conscientious and kind when I'm also trying to educate. I think all of this I'm trying to do at the same time. I'm incredibly honored. I'm a little anxious and I am highly motivated to keep moving forward.
You're doing amazing. You're doing a great job.
Thank you.
I want to bring it back to your internship. When you were interning at ABC, did you always have in the back of your mind like I want to be in front of the camera, or did you just want to
Yeah,
like maybe
I was
just work in a
completely
medical unit?
Cervantes, you know me, I was completely delusional. I think you have to be a little bit delusional to pursue your dreams. I always thought that this is where I would be, and so I'm not really surprised about where I am. I'm more trying to always figure out where is the next step, and I'll let you know when I find that out.
That's amazing. I love that. I love that. And especially in this industry, you do have to be a little bit delusional. Like, yeah, out of all these people, they're gonna pick me to be the director. They're gonna pick me to be the
Yeah,
co-host of GMA3 or whatever it is. So I
yeah.
agree with that. I agree with that. What is your day-to-day like now as an ABC News medical correspondent and emergency medicine physician?
Yeah, well, my emergency medicine usually is variable throughout the week. There are weeks when I'll work 2 to 3 days in the emergency room. There are weeks where I'll work one or maybe just two. And then the news is the news. You work with me in the network, so you know very much how the cycle can be dependent on what people want to hear, but also what information is coming from our administration, what information is coming through pop culture, how to bust some myths, new studies that are being published every single day, and the lack of resources or resources being taken away from those very same infrastructures that provide us quality and care and health. And so there's so much to talk about. So the week is very much how an emergency medicine shift feels like, very random. And very much quick turnarounds with close pivots and close commercial times and little breaks.
That's true, bro. They're very similar.
Yeah.
So going back to the schedule, so you would you say ABC is more every day?
ABC is my full-time everyday job, and then the
Okay.
emergency room is when I'm off, or in the evenings and the afternoons is usually when I work in my emergency room, and so that's how I schedule myself. My weeks are really different, and my schedule I just kind of decided on Monday or Sunday. I'll usually make a plan on what that week is going to look like, and then just put my feet on the ground, stand up, and walk through it.
That's amazing that you're able to do both and that both jobs and bosses let you do that. Because I know for some people that couldn't work out if they were full time at both places, or maybe they could, but I think that's very cool. And it just shows the dedication. Like I really want to educate my community, but I also, this is what I went to school for, and I have a bunch of student loans in, so I need to also make sure I'm doing this as well. So that's
Exactly. I think
incredible.
it's just, I'm also blessed that I get to do things that I'm actually interested in. I love emergency medicine. I love being a correspondent. So for me, my story is a lot more privileged because I have a true love in what I do. And I think when people ask me about, how do you work so hard? How do you work so much? I think it really is difficult to quantify it when I really do. All my heart is in it.
If you love what I get that. That makes sense because if you love what you do, you're gonna find a way. It's
Absolutely. I get
hard,
excited.
but it's like you're not gonna complain. You're gonna figure out
Yeah.
a way to make it work.
Yeah.
So I get that. I get that.
Yeah.
At Bellevue Hospital in New York, like you mentioned earlier, you developed a passion for addressing systemic inequities of the American healthcare system. During your bus rides to the hospital, you posted on social media about health issues you cared about, amassing a dedicated following of 2.1 million followers on TikTok and 263,000 followers on Instagram. What are some specific healthcare issues you care deeply about and want to change? And how has your experience been using social media to educate people on certain medical issues?
Well, I think I'm always, well, first off, thank you so much because that was a beautiful history that you just ran through. I appreciate that so much. It makes me seem so
Yes.
important. But I always try to, my career teaching through social media really started by teaching about basic health concepts that we all could possibly end up with in the emergency room and what it would feel like if I had all the time to sit and really explain to you with pictures and graphics. That elapsed into more of a storytelling concept, which is something that I really love to do because I do believe that proper storytelling can really educate. Because if you can create a line of thinking that is entertaining but also educational, I think it's one of the coolest ways for people to figure things out. So that is kind of what I lead by. I think now when you hear me speaking about cases, there will very likely be this concept of what I'm always trying to do, which is teach more than one concept within one storyline. And so I really enjoy talking about how individual problems can be related to community health investment and what it looks like when we have access to care versus when we don't. And and how it's so important to pay attention to the movements of the administrations that create policies that unfortunately, in many ways, can hurt us. So we must be able to identify, recognize, and counteract those measures as much we can. And I think it's so important to understand how things work around us and inside of us.
That's beautiful. I think that's so true because you have a really powerful video about hunger. I think it's pinned on your profile. I forgot the first words exactly. I think it's like, "Are you hungry right now?" It's like it really grabs you, and I think it's true. It's like if you can talk about such a complex issue in a 1 minute video, 2 minute video, that grabs so many people, and our attention spans are so short, especially Gen Z. So it's like for you to capture that audience as well. It's like, oh wow, because some people my age, I don't think they're gonna go research and pick up a textbook, but if they can like watch your video and then, oh, I want to learn more about this and then go read that textbook, it's like, oh, like you just got it. You just successfully was able to grab an audience that wouldn't normally be interested and is now interested based on your delivery, the high follower amount that you have, and the way just like the way you do it, just breaking down complex issues that we normally aren't educated about in school or just talking day to day. So I think that's amazing too. You educate people on, Good Morning American, ABC News Live, too, about these systematic racial, sexism, homophobia through those issues. How does that look like at the hospital? How do you make change at the hospital?
My change at the hospital is very individual. I think what's important to understand is that when I'm communicating on large platforms like a network television platform, I'm communicating for the public. I'm acting very much as a public health educator in many ways. When I'm treating patients, that is an individual experience. And I have to be clear that I don't bring all of my public health concepts and lay them on a patient in the middle of a crisis. I think it's really
Right.
important to understand that each and every person, when they come into the emergency room, they are there because they have a fear, most often that their life could end that day. So it is a very different experience. I think that what I try to do is to be the best physician that I can be, and that really honestly just starts by listening. And so that's really where I sit. I get my most education from my patients. And my way of participating is providing what I think are the best, most founded, evidence-based opportunities and options for them to then help treat their problem and hopefully help to prevent them from having a real emergency.
It's really that simple. Listening. I think a lot of
Yeah.
times, us as Black people, people of color, Latinos, we go to the doctor and we're scared, like you said, of like, this person's not going to take me seriously. You look at Black maternal mortality, that stems from non-black healthcare people not taking the fears, the stresses, the anxieties of black women seriously, resulting in so many deaths that could have been prevented if the doctor just listened or, hey, I think I should get this type of test. Okay, yeah, Miss So and so, let's run that text. Let's run that test so that we can rule out this possibility, as opposed to just saying you're lazy, you're overreacting. So I think maybe it really is just that simple as just listening. I wonder also too, like, do physicians get the chance to meet with the administration and talk
Yeah.
about policies? Is
Yeah.
that a thing?
I think that there's a couple of answers to this. To step into the access to maternal care, which is what you were mentioning in terms of being listened to. That is certainly a huge component of it. But in many ways, patients don't even have access. We have maternity care deserts all over the United States, and what that is these are counties, a county without access to an OB provider or maternal care, and they are growing in a setting in places where we are having more restrictions on reproductive care that inevitably leads to disparities in care because those who can't drive, who can't fly to get the access that they need are the most often going to be affected. So I think it's so important when we talk about these issues of policy to take a step back and realize what the bigger picture looks like. And I think in the individual experience of physicians, there are certainly times and moments when we can speak to policies within our hospital, but those are most often run by state policies, which is why it's so important to remember that we all need to be proactive in our both local and federal, state, county, all of them, to make sure that you use your basic voice in order to make a change that benefits you and your community.
Use your privilege of voting to
Yeah,
make a difference
yeah,
because it's I think some people think my generation thinks that doesn't matter, or like if you live in a blue state, it's gonna be blue. My vote doesn't count. You live red, it's gonna be red. But it's like, no, it's not just about president. It's not just about who's the presidential candidate. It's about the person that decides roads and taxes and the school and even hospital. I forgot about the hospitals. So that too. So
yeah.
it really does
We
all
all need to make sure
true.
that we exercise our basic right. And it's even hard to call it a privilege now. I used to do the same, and now it's just like these have to be just the basic functions of being a civil or a part of a civilization. You just simply have to. It's not a. We should stop doing privilege. We should simply say, just like you should definitely get a basic checkup with a primary care provider. You should do your taxes. You should vote.
Right. It should I low key wish they made it mandatory. I
Yeah,
feel like
it
that would
should. It's very
change.
much
Yeah.
I think we should make access to voting as possible as possible as it can be by making sure that people don't have to have a difficult time getting to basic voting booths. And unfortunately, that
Yeah.
ties into the bigger picture of what we talk about all the time, which
That's a
is
that
access to basic stuff.
that's a whole nother podcast episode.
Whole other TED talk.
Do you have a favorite or memorable, you've reported so much, but do you
Yeah.
have a favorite or memorable story you have reported on?
Yeah, certainly. Natasha Allen, she is an incredible hero, and she is surviving stage four sarcoma. And she was a part of an incredible story talking about how we're seeing a rising rate of cancer in young people, albeit the overall numbers of cancer in young adults or under the age of 50 is relatively low, but the rate of increase over the past decades, 10 to 20 years, has increased significantly. And Natasha was unfortunately a part of this increase in the rate of cancer. And it was incredible because she is such a powerful woman. She is on social media sharing her story. And it was a story of persistence, it was a story of resilience and strength and beauty. And I think that she's an incredible woman. And I would encourage everyone to follow her story to understand the reality of what it's like to live with cancer today.
Right. And it's like I wish cancer is such a tricky thing, and it's such a heartbreaking thing because it's one of those diseases that you can get no matter you're healthy and you're like The Rock or
Yeah,
you're super unhealthy. Cancer doesn't discriminate, for back
yeah,
of the word.
it's true.
And it's really heartbreaking. I love that. I have to read up on her. That's
Yeah,
amazing.
she's great.
If you don't mind sharing, and if you are able to share, do you have a story from your time as an intern, resident, or now as an attending that has had a profound impact on you and or has changed the way you view medicine and the healthcare field?
Sure. Shannon McNamara, which was one of the physicians that I talked about, where I was inspired. Death is unfortunately, a part of my career, and I have witnessed and declared more death than the average person, being an emergency physician. So, as much as I love to talk about the beauty and the miracles of medicine and the births, we also have to talk about those patients who ascend and what you should act like in those moments and how you should treat those moments with care. And after experiencing my own form of grief, it really changed my perspective. And Dr. Shannon was one of those people who, at during a death, watching her declare a death was such a powerful moment. She took a moment of silence, and it changed the way I practice medicine because then I realized, oh, I can be my caring self in these moments. I don't have to be or embody the structures that taught me to kind of depersonalize the experience of medicine. I can be a human. I can acknowledge when I have sorrow, and I can embrace people when they are experiencing that. And it was a moment that really helped me become my version of the doctor I've always wanted to be. And so, yeah, that was one of the inspiring moments.
That's amazing. That's amazing. Like you learning how to be human essentially and not be a robot.
Yeah,
I feel like
yeah,
I've seen that
exactly.
it's fictional, but I've seen that on Grey's Anatomy with Sandra Oh's character, Christina Yang,
Yes.
where she was very, very type A personality and was like, your patient died, like just very blunt. And she had to learn over time, you need to learn how to talk to people.
Yeah.
How would you feel? And I think she had a loss in her family, and then it's like, okay, there's some character development, but going back, to what you said, I think, yeah, people want a doctor that, I don't know, maybe not your friend, but is human.
Yep.
Maybe is your friend. Maybe you do want your doctor to talk to you like a friend because, how would you feel in that situation? So I love that, learning how to be human and really connect with your patients. Because at the end of the day, they shouldn't be treated as just a number or just like an
Yep.
ID on a page. Like this is a real person. They have families, they have feelings, and it's not until you're in that situation where it's like, okay, now I know how it feels. But you have two very demanding, high stress careers that you seem to excel at. How do you handle work-life balance and time management?
I have to say that my career and the way that I function is not normal. So I'm always doing work. I can't stress enough that this is not the way that I would prescribe a lifestyle for someone. I've got big dreams, and my dreams are fueled by the work that I'm doing, and I can't stop. So I have to acknowledge that the way that I work is probably not what I would define as a healthy work-life balance.
Okay, okay.
Tips and tricks. I think for me, the most important things in my schedule, to be honest with you, is that work kind of never ends for me. But the one thing that I prioritize is sleep. I don't. I think sleep deficits are a big part of uh, why we might be seeing rises in chronic disease and mental health a diagnosis. Mainly because I think a lot of it is I think we are becoming chronically sleep deprived, and I think focusing on getting good quality sleep is so important for so many reasons. So I would have to say that behind work or next to work, probably my priority is sleep. And I make decisions based off of how much this will motivate me and will this affect my quality of sleep. It sounds it sounds crazy, but I think about those two things with most of my decisions. And when things start to affect my quality of sleep, I recede. And yeah, I make sure I'm getting enough exercise. I work out every day. I
Okay.
probably I probably start most of my days with some level of a workout for 30 minutes, whether that is basic weightlifting or basic cardio exercise. I I stick to I have the privilege and the access to stick to a diet that is um, very whole food centered and very minimal added sugars and processed foods, and I get quality sleep. And those three things give me so much power to continue to move forward. So that's how I kind of balance it.
I think that's great because that I was gonna say like how do you make sure that you don't burn yourself out? And I guess it's kind of hard because it is such an unorthodox type of two
Yeah.
career lifestyle. So you probably do get burned out. But I think that working out, prioritizing sleep, I think that helps to like lessen the crash out, I guess, at the end of the week or at the end of the day.
Yeah.
That's amazing. And
If you,
eating
your
whole
body needs
food.
fuel, so I just try to make sure that I treat myself well.
Right. And I think too, like it's that phone. I think it's that phone that like
That damn
hurts
phone.
us. It's that damn phone that hurts us sleeping. I've been trying to read before I go to sleep, and it's helped so much because instead of looking at this screen, I'm looking at, this book, and it really does help. So I think that helps.
Yeah.
Incorporating fitness, prioritizing sleep, I think that's something all adults should definitely do for sure. Like we
Yeah.
mentioned before, there's Grey's Anatomy, The Pit, General Hospital, ER, The Good Doctor, and so on and so forth. Is there a television series or even a movie that you believe gets it right or is more accurate than the rest?
Well, I was inspired from the ER show as a child, so I think that's one of the most. I haven't seen it in a while, but I'm sure that it would still be as entertaining as it was when I was younger. And then I think, of course, you said it already. The Pit is a great, great. I think it's just so creative how they function that show and how they create episodes from hours. And I think it's the most realistic assessment of what a day in the emergency room can look like, albeit that is a very hectic day that I'd probably need to take an extensive break after. But it is a really good example of what how diverse of a day and how different problems can appear. And I just think that everyone should watch it if you're curious of what it's like to be an emergency physician.
I see everyone talking about it, and it seems really cool. I see it always on social media, and there's a doctor like yourself who's also a YouTuber who he watches different medical shows and debunks different stuff. Like they got
Oh
this,
yeah,
got that right, and he also mentioned the pit. So it's funny that you say that. That's dope.
yeah, it's great.
There is a plethora of medical misinformation we are fed with online. What are
Yeah.
three medical myths you have seen or heard over the years or recently that you would like to debunk or address?
I think right now, since we're in the midst of the second largest measles outbreak in over 25 years, since measles was declared eliminated, secondary to the fact that we're seeing a decrease in the rate of kindergartners and children in general getting vaccinated from a protective amount of about 95%, which is what you need in the community to prevent measles outbreaks. And right now we're down to around 91%. There's about 280,000 children in kindergarten right now that are not up to date on their vaccines. And we have over 1,000 cases of measles within the United States, likely an undercount, as testing is not always as universal as we would hope it could be. Secondary to a lot of misinformation circulating about vaccines, and unfortunately was accelerated through the pandemic as many people became fearful of mRNA vaccines, and that kind of unfortunately spread into fear of MMR vaccines, which are the measles, mumps, rubella vaccines, which have been around since the 1960s, 70s. And unfortunately, I think it's a lot of it is tied into people seeing these provocative headlines without really digging into the data. And if you just basically if you take a basic moment and read the larger studies, you would understand that there is no link between autism and vaccines. And over 25 million children around the world have been evaluated to answer this question. But unfortunately, a study based in less than 15 children has unfortunately continued to persist due to these provocative abilities of content creators that are producing content with the hopes of educating, but it comes at a cost of accuracy and context. So I think it's so important to understand. And I'll just say that that is one instead of, I know you asked for three, but I think I've given enough reason to help people understand why. I think that's probably one of the most important myths that we have to continue to bust today.
Yes, I know. I think that's that's powerful. It makes me think back to COVID. I wish I wish I knew you and interviewed you back then because
Yeah.
I would go to work and there was people saying like, there was that thing that black people couldn't get COVID. And it's like, well, that's true. That was wrong. Like there was just so much myths or
Yeah.
I was at a wedding and somebody was like, oh, I was wearing a mask and somebody was like, oh, COVID's not real. I'm like, where are you? And these are grown people. I'm like, where are you guys getting this information? But I think it goes back to social media. So thank you for debunking that because And even we do it at a smaller scale too. We feel symptoms of something. What do? We go on WebMD and try to diagnose ourselves instead of doing our own research or just going to a doctor. So thank you
Yeah,
for educating us on that. Because yeah, do your research.
yeah.
Don't you would think people would know by now in 2025 that not everything you see is real, but
I know, but it can,
until
and
they're a
I get
doctor.
it though. I get it. It's very enticing, and the point of the content that we see online, the point of all of the content, the goal of that creator is to engage, to get likes, to get shares, and again, that can come at the cost of accuracy and context. So it's so important to know that every single time you see a piece of content, that's someone creating content with the hopes that you'll engage with it, and that often, unfortunately, comes at a sacrifice of data and evidence.
Yes, and I hope that because you get such a good response being on ABC and you have such a high following on social media, I hope that that inspires other networks and other doctors to like, ooh, this has worked out for this person. Let me go to social media and also try to educate as well. And networks like NBC and CBS and all, I hope they can find a Dr. Sutton, whatever, and try
I'm
to
sure they will.
it's working clear. It's working here, which means there's an
Yeah,
audience. Let's
yeah.
let's do that too. So we'll see. We'll see what happens. Finally, last question. What is your advice for young people who want to pursue a career in the medical field one day, especially those who want to become doctors like yourself?
Well, I would say that if you want to pursue a career in the medical field, I would hope that you take a moment to understand that there are so many opportunities to help someone within the field of medicine, not just from a physician's perspective. So take the time to learn about what everyone is doing on the group, because everyone on my team in the emergency room is vital, and in the hospital is a vital part of patient care. So take that moment, and then in general, for everyone, just remember that when you are creating, when you are doing something, that you want to make sure that when you are creating something, you have one diehard fan that will always watch it and interact with it. And this is for those who are trying to be educators, obviously, and trying to gain platforms. Just know that you have to have a fan that is a diehard fan that will watch it over and over again, and that fan has to be you. You have to be the person who is the most supportive of your dreams, and you have to make sure that you are always standing behind the concepts that you're sharing, the content that you're creating, the messages that you're providing. Because if you're not standing behind it, then no one is. And so just take a moment, ask yourself, is this something that I care about before you decide to put that out there? And don't try to be hyped by the rush of content that is out there. Take moments to be fact based, take moments to look at the data, and take moments to perfect your craft.
I love that. Yeah, because what you're posting it, it's gonna live on social media, it's gonna live on internet
Yeah.
forever. So you should stand by what you said. And you have 2 million followers. I'm sure you started at one. So it takes time.
Yes.
Things take time. Don't beat
Yes.
yourself up and
Yeah. I've been doing
you
this
gotta
for
believe in
10
yourself.
years. So,
Wow. I didn't know it was that
yeah.
long. Wow, that's amazing.
Yeah, yeah. I started my journey 10 years ago. So I feel like it to me, it's like this is just again, this was
Not
inevitable
everyone's
because
like
I kept going.
Monet. Not everyone's like Monet McMichael that blows up in 2 years. It
Exactly.
takes it takes
Exactly.
time. It takes time. At the end of every
Exactly.
episode, I like to ask my guests a couple of rapid fire questions.
Okay, let's go.
Ready? Okay,
Yeah.
first question. What makes you laugh the most?
Oh, oh my gosh. What makes me laugh the most? Babies.
Babies. Okay.
Yeah.
Three.
Honest children are so funny to me.
I love
Because
that.
children don't have any space to lie.
No, they'll tell you how it is. They'll tell you
Yeah.
to dress bad,
Kids.
don't smell
Kids
good.
make me laugh the most.
Three things you're grateful for.
I am grateful for my health. I'm grateful for my family, and I'm grateful for love.
Love that. What would you tell your younger self?
I would tell him, you were so cool. You have no idea how cool you are.
I love that. I love
Just
that.
make sure you continue marching to the beat of your own drum, and don't let other people cloud out your parade that you know is always ongoing.
Oh, okay. Okay. I love that. Where do you see yourself in 5 years?
I'll let you know. I'll let you know. At this point, right now, we are we're trying to do so many things, and yeah, I'll let you know. That's hard. I will say that's hard now. I can't do it. I can't come up with that answer at this moment.
Right, because it's been like you interned,
Yeah,
then you ABC,
Yeah,
then
I'll
you got
let you know.
promoted.
I need to go to my next therapy class and then come back and inform you.
I love that. We're manifesting good things.
Yeah.
What would you name, last rapid fire question, what would you name this current chapter of your life?
Ah, peace.
You're like the fastest. Everyone always gets stumped by that one. That's okay. I like that.
Because I'm always thinking about what this time period means for me. And right now it means peace. It means stabilization for me. And it is laying groundwork and getting my footing so that we can continue climbing this mountain.
I love that. And it's like it's comforting. It's comforting that you don't know what you want to do yet in
Yeah,
5 years.
that's
Everyone always
okay.
has an answer. And I think that's it's like, oh, you think somebody like has it all planned out all together. And it's like, oh, it's okay to like not know. It's
Yeah,
okay.
it's
I like that.
completely.
I like that. Thank you so much, Dr. Sun, for taking the time
Thank you.
your
This was
busy
great.
schedule to join me on the podcast. Where can everyone follow you?
On Dr. Darien, Doctor Darien, Darien on my platforms. If you just search it, you'll find me.
I want to hear from you guys. So if you're listening to this episode right now on a podcast platform, be sure to leave a rating on Anchor, Apple Podcasts, Spotify, or wherever you listen to podcasts. If you're watching this episode on YouTube, don't forget to like, comment, and subscribe. And make sure you click the notification bell up top so you're notified whenever I upload a new episode. Thank you guys for listening. Have a good one.